Assalamu alaikum wa rahmatullah. It is a pleasure and honor to be with you today and share with you a very important presentation. And this presentation about diabetes remission. And I believe a lot of you are now start to hear about diabetes remission and who can achieve diabetes remission and how we can achieve diabetes remission. So let me start by showing you the early observation of diabetes remission, which we published back in 2015. So in 2015, almost 8 years ago, we found in our weight management program the weight achievement and intensive treatment Y-Weight program at Joslin Diabetes Center, which is a multidisciplinary weight management program for people with diabetes, that 21% of those patients who lost weight got remission from diabetes. And we start to ask ourselves why those people get remission from diabetes and what is a common theme between all of them. And we found that they are sharing in three criteria. The first is that they have diabetes for less than 5 years. Second, that their A1C, when they started the program, was lower than 8%. And then finally, they are on 2 medications only, up to maximum dose, but not on insulin. So we found that most people who achieve remission are sharing these 3 criteria, although there is some exceptional, of course. So let me first define what we mean by diabetes remission. There is a consensus statement in 2021 between the American Diabetes Association and the European Association for Study of Diabetes, and they defined the remission as A1C less than 6.5% for 3 continuous months and on no medications. So anyone can be on no medication 3 months and keep A1C less than 6.5. This is what's called remission. If it is prolonged beyond 3 months, this is a long-term remission. So if there is a pathogenesis for remission, and this is possible from physiological point of view. Back in 2003, almost 20 years ago, we did a study at Joslin Diabetes Center, helping people to lose around 7% of their body weight. And we were shocked that their insulin sensitivity improved by 57%. I remember I was whispering to my colleagues at that time saying, if insulin sensitivity improved that much, we may be able to reverse the diabetes or even be able to put diabetes in remission. And people who repeated the same study, they found 70%, 80% even improvement in insulin sensitivity. And if we believe that insulin resistance is a core problem, improvement in insulin sensitivity can make big difference. So we know that when people are in their way to develop diabetes, they move from obesity to pre-diabetes and start to be insulin resistant. And as you can see, they remain insulin resistant as long as they are overweight or obese. Pancreas compensate and beta cells secrete more insulin at the beginning and then less insulin. This is what's called beta cell dysfunction. But we never asked ourselves, if we improve insulin sensitivity to the maximum, we'll be able to reverse diabetes or induce remission. As you can see, during the first 5 years, there is still high insulin secretion. And this, in my personal opinion, a glorious period that we shouldn't miss if we are aiming to induce remission or reversal of diabetes. And that's why most of those people who have remission from diabetes have duration of diabetes less than 5 years. And in reality, beta cells don't die. What usually happens is that when the blood glucose starts to go up with severe hyperglycemia, beta cells transform itself into progenitor cells and take the fate of alpha cells. So beta cells become alpha cells and starts to secrete glucagon. Once you improve insulin sensitivity and people lose weight and glucose toxicity is cleared, alpha cells became again progenitor cells and take the fate of beta cells. So it looks like there is always a dynamic movement between beta cells and alpha cells in that scenario. So what are the interventions that can induce remission? And we know a few of them right now. The first is bariatric surgery, as you know, especially when people do it in very early in diabetes and lose more than 10% of their body weight. But there are many other ways that help people to achieve remission from diabetes. And the non-surgical ways are basically helping people to lose around 10% of their body weight. But we have to ask ourselves what nutrition plan, what calorie composition, and also if there is meal replacement use or not, what exercise, what duration, what intensity, what frequency of exercise, what behavior that will do, and if there is any other medication that will be used. But the most important, if we will be able to induce remission, we have to be able to maintain remission for a very long time by improving compliance. So studies started to show that if we need to induce remission in diabetes, we need 10 to 15% weight loss. In reality, every 1 kilogram weight loss raise the odds for diabetes remission by 32%. So any weight loss, especially early in diabetes, raise the odds for remission significantly. So the first approach, which I told you earlier, is Y-weight program, which use the medical nutrition therapy in a structured way and exercise designed specifically to maintain muscle mass. You need muscle mass to be kept up during that weight loss. It also includes some behavior modification called cognitive behavior modification and adjustment of diabetes medication by reducing medication that cause weight gain and continue medication that are weight neutral or improve weight loss. It is a group intervention program for 12 weeks. And what we found that people after 12 weeks lose significant amount of weight, as you can see here, between 8 and 12%. Here is the average around 10%. But interestingly, after 5 years, this is not 1 year or 2 years, they are still maintaining 6.4% weight loss. And I told you before that 7% weight loss improves the insulin sensitivity by 57%. We started to follow those people after 10 years, and this was published in British Medical Journal, and we found people are still around 7% weight loss after 10 years. So people can maintain weight loss by structured nutrition plan with exercise that keep muscle mass up. Interestingly, more than 50% of those people, around 53%, were able to maintain around 9% weight loss. This year in the American Diabetes Association, we presented data for the first time ever, around 15 years. And again, after 15 years, they are still 7.6% weight loss. And the group that lost more than 7% in the first year were able to maintain around 11% weight loss. Those people cut their medication down by 50 to 60%. And as I mentioned before, 21% achieved remission from diabetes. The second modality to induce remission is to put people on a very low calorie diet. Very low calorie diet is 800 calories to 1,000 calories. And as you can see here, there is a comparison that was done between gastric bypass surgery and very low calorie diet. and here is insulin sensitivity, and here is acute insulin response, which is indicator of beta cell function. And as you can see, bariatric surgery improved both, and very low calorie diet improved both insulin sensitivity and beta cell function, exactly similar to what you can get from bariatric surgery. So this led to a study called Direct Study, which was done in Scotland. And basically, they give people a total meal replacement in the form of shake and bars. They give them 800 to 1,000 calories to evaluate diabetes remission. And they give them that for 3 months, and then beyond that, they start to gradually return them back to their eating. Interestingly, people who lost more weight, and here is people who lost 15 kilograms or almost 15%, they achieved around 68% or 86% of them achieved remission. People who lost less weight, here is 10 to 15 kilograms, around 57% remission from diabetes. So it looks like remission is related mostly to the magnitude of the weight loss. The third modality, or the fourth modality now, because I told you bariatric surgery, multidisciplinary weight management program, and then very low calorie diet, very low carbohydrate diet. Very low carbohydrate diet can also induce remission. Here is many studies, 23 randomized clinical trial, showing the odds for remission is also significantly high. But interestingly, remission doesn't stay beyond the 6 months. So let me first tell you, low carbohydrates means less than 130 grams of carbohydrates. Very low carbohydrates means less than 50 grams of carbohydrates. And as you can see, in the first 6 months, the odds of remission is significantly up, but at 1 year, it is not significantly different. Again, A1C dropped significantly down during that period in the first 6 months, still down in the first year, but it is not as significant as 6 months. Of course, weight loss is significant as well in the first 6 months, but nearly that effect is gone in the 12 months. So very low carbohydrate diet can induce remission, but very short period, around 6 months only, but not beyond 6 months. Now came the DROP program. This is newest stone in the block, and it is very exciting. We are very excited about it, and I think this program will be among the guidelines in the future for people with early diabetes. DROP, abbreviation of Diabetes Remission Outcome Protocol or Outcome Program. And the reason for developing DROP program, that we know that all modalities that we have right now for diabetes remission, like bariatric surgery, very low calorie diet, or very low calorie liquid diet, they are extreme. People cannot endure it. They cannot maintain it for a very long time, sometimes unsuccessful in maintaining remission for a long time. I told you about the low carbohydrate diets. And they are accompanied significantly with loss of muscle mass. This is a major issue. Or maybe what people even at the verge of malnutrition. So that's why we were looking for another way, innovative, doable, people can do, can be easily implemented in clinical practice, and can achieve longer duration of remission. So the idea for DROP program is to stop all medications at the beginning of the program. So we're not waiting long. At the beginning of the program, we stop medications that people are using. But again, to those people eligible for the program are people newly diagnosed with diabetes within 5 years, A1C less than 8, and on just 2 medications. So it is not for anyone with type 2 diabetes. It's only specifically for this population. That's what we found in the Y-Weight program. So the intervention, there is two phases. The first phase is what's called intervention phase, around 12 weeks, and then followed by drop maintenance phase, which is nine months. So during the initial 12 weeks, we give people 800 to 1,000 calories, so very low calorie diet. But we are not just to replace all food by meal replacements. We are actually giving them natural food and diabetes-specific formula, 200 calories of that diabetes-specific formula. And then during the maintenance phase, we return them back, women to 1,500 calorie and men to 1,800 calorie diet. The macronutrient composition is very important. We reduce carbohydrates to less than 40%. We give them more protein to maintain muscle mass. We give them 1 to 1.5 gram per kilogram of protein, and healthy fat from MOFA, BOFA, and omega-3, monounsaturated, polyunsaturated, and omega-3. So this can come from fruits, vegetables, grains, healthy protein, and healthy fat. So the way we do the program, we include time-restricted eating for 16 hours. So people eat their dinner and they fast for 16 hours. They can drink, of course, water, tea, coffee without sugar, without any whitening, but 16 hours of fasting. And then they break the fast on 200 calories of diabetes-specific formula. In our program or study, we used the Glucerna, 200 calories, so people break fast on 200 calories. And then in the evening, we give them a dinner of natural food, around 600 to 800 calories. So the total per day is 800 to 2,000 to 1,000 calories. And then they start to fast again, and they continue that for 12 weeks. We give them a continuous glucose monitor, and we requested that timer range is always above 70%. And we said that if it is below 70%, we can return them back on medications. But fortunately, we didn't require that. But it was very valuable to use continuous glucose monitor. Here is the Freestyle Libre 3, the newer version of Freestyle Libre. So we stopped the medication, as I told you, from the beginning of the program. We told the people we need to maintain timer range more than 70%. But if it is lower than 70% in the first 2 weeks, we can put them back on one medication at least. And then during the maintenance phase, we need to keep timer range above 85. So if it goes below 85, we ask them to repeat 1 week or 2 weeks again. Of course, if they reach less than 70%, we put them back on one medication. We evaluated A1C every 3 months, and all other tests like lipid profile, urinary macroalbumin, creatinine, lipid profile, liver enzyme, GFR, and CRP every 6 months. The exercise is very important in this program because it is 3 types of exercise: flexibility or stretching, aerobic, and strength, but more emphasis on strength exercise. As I mentioned, we need to keep muscle mass up, and we ask them to do exercise after dinner. So they eat the protein, and then they do the strength exercise after dinner. In the morning, they can do some stretching or some little aerobics if they can. We give them a stretch band. This helps them to do strength exercises. Some people can use weights in that scenario. So let me give you the summary of the intervention. As I mentioned, the intervention phase, we discontinue medication at the start of the program. We give people time-restricted or advise them for time-restricted eating like fasting 16 hours. We give them very low calorie diet, natural food, and diabetes formula, especially has protein, higher protein, 1 to 1.5 gram. We give them more strength exercises, techniques to maintain lean muscle mass. And then we have cognitive behavior modification. And as I mentioned, each one has continuous glucose monitor. During the maintenance phase, as I mentioned, we return them back to 1,500 to 1,800 calorie, carbohydrates less than 40%, and we aim to maintain timer range above 85%. Failure to maintain 85 will require them to repeat 1 to 2 weeks. But if they reach less than 70%, then we have to start medication. We did a very small visibility study to see how the program works, but there is a big study going on in 5 countries across the globe. Again, remission is defined as less than 6.5 for 3 months on no medication. This is the 3 criteria which I told you about them. What we found in this group that A1C went down from 6.4 on 2 medications down to 6.1 on no medications. So this is very important. The number of medication in average around 1.6, and during the 12 weeks and after the 12 weeks, no medication at all. And the time in range went from 91 up to 97%. So this was very powerful. The duration of diabetes, as you can see, is around one year. Weight went nicely down around 8% in the 12 weeks. And you can see consistent weight loss. And A1C, as I told you, from 6.4 on 2 medications to 6.1 on no medication. As you can see, timer range had been always in very good range, around here 99, 100%, 97, 96. So it is very consistently in the range in a very good way. And then we evaluated the loss in the muscle mass, loss in fat mass. As you can see, most of the loss is in fat mass, from 97 pounds to 83 pounds. And we also calculated muscle mass to fat mass ratio. As you can see, it went up, which means that we're able to maintain muscle mass, because that's what will help them to maintain weight loss for very long duration. So this is a very encouraging data. After 1 year, 80% of participants are still having remission with A1C less than 6.5% and with time in range more than 85%. We evaluated quality of life, mental and physical quality of life. It improved in 100% of the participant at 12 weeks and also at 1 year. So it looks like quality of life is improving and people can maintain remission for the entire year. So this is the intervention team and the patient that had been in the very initial pilot of the program. And I think DROP is a novel and doable protocol that can induce diabetes remission and improve quality of life among patients with type 2 diabetes, newly diagnosed in real-world clinical practice. I think we are coming to a very interesting and very encouraging era. We are conducting now a big study in US and in 5 countries across the globe, and I hope it will be everywhere. Let us look how the future will look like. I think in the future, if people are at risk for obesity and diabetes, they should be on a wellness plan, not to gain weight, not to develop diabetes. If they start to gain weight or they have risk for type 2 diabetes, they have to go through a diabetes prevention program. If they have pre-diabetes, they will go into diabetes prevention program. And if they have early diabetes, they will go for the DROP program, diabetes remission outcome program. And if they have diabetes and established diabetes, they can go for Y-weight program, they can cut their medication down. So I think we are able to reverse the course of the disease in a very nice way by weight management and without even need for any medications by very good lifestyle intervention, as I just mentioned. So DROP is a novel and doable protocol to induce diabetes remission and improve quality of life among selected patients with type 2 diabetes in real-world clinical practice. And as I mentioned, there is a big study going on. I hope one day we will reach together to a diabetes-free zone and say goodbye medications, especially early in diabetes. With that, I would like to thank you so much for good listening, and I enjoyed being with you, and I hope you will have a wonderful symposium from Boston. I would like to thank you again, and looking forward to meet you in the near future. Thank you very much. It's a pleasure.